Early in the pandemic, when businesses started to reopen, many installed plexiglass barriers in order to reduce the exposure to hazards like COVID-19. But it turns out those physical barriers may not be as effective as we hoped.
While very seductive and convenient, they offer a false sense of security. Of course, there are practical concerns in terms of the positioning of the plexiglass partition, how high it is, how wide it is, how often it's cleaned.
Dr. Wafa Al-Sadr, a professor of epidemiology at Columbia University, says that's the same issue with plastic face shields. She says though they are more convenient and easier to wear, they are not a replacement for physical distancing and face masks.
We know that, of course, the virus itself can be in much smaller particles and can go around the plexiglass.
Also, plexiglass hasn't been scientifically proven to shield the aerosol droplets that spread from sneezing, coughing, and talking. But no need to throw those plastic barriers away. Instead, they are best used in addition to face coverings and physical distancing of at least 6 feet. For today's Health Minute, I'm Meredith Wood.
Having really a protective glow means something. I think it's very important to have that.
President Trump says he's immune to COVID-19, but he doesn't have any evidence.
The word immunity means something.
Medical experts agree it does mean something. It's why Dr. Saju Matthew is so cautious about using that word.
I would never use the word immunity with COVID-19.
That's because immunity to this virus is something we still don't know a lot about.
There's no sense that we're getting in the scientific field that you can actually be immune to COVID-19. We know that you can build some level of immunity for maybe a couple of months, but we also have studies that have shown that after 2 months, the immunity goes down.
And there are documented cases of people who had COVID-19 and then got reinfected. The CDC has specifically cautioned people not to assume they're immune, saying immunity has not yet been established. But it's something scientists are working on. The U.S. National Cancer Institute just launched the Serological Sciences Network for COVID-19, or SeroNet. On a webinar, Principal Deputy Director Douglas Lowy says they'll be working to answer a number of questions in what's been described as the nation's largest coordinated effort to study the immune response to COVID-19.
I am hopeful that by the end of this year that we will have at least partial answers.
I'm Britt Conway reporting.
The Centers for Disease Control and Prevention is out with a new warning, drawing another link between young people and some of the nation's COVID-19 hotspots. The CDC found positive test results generally started rising among people under the age of 25 about a month before a region was designated a COVID-19 hotspot. With the study, researchers are underscoring the need to address young people helping spark outbreaks. A local survey in one Wisconsin county showed young people worried they would feel weird or get odd looks wearing a mask.
It starts out, first of all, with college students coming back to universities and colleges, and we're seeing substantial transmission there, which then is spilling over into the older adult population.
This week, the U.S. posted its highest number of single-day COVID cases in nearly 2 months. Only a few states, those in green, are reporting declines in new cases this week over last. In Ohio, Governor Mike DeWine predicting a very rough winter with both hospitalizations and the average age of patients edging up.
Every single number is going the wrong way.
In the Northeast, the moving average of new cases from September 8th to October 8th went up a staggering 91%. Dr. Deborah Birx of the White House's Coronavirus Task Force warns one possible reason is silent asymptomatic viral spread among families.
The communities that are seeing upticks, please bring that same discipline that you're bringing to the public spaces into your household and really limit engagement with others outside of your immediate household.
In parts of New York City's Queens and Brooklyn boroughs, calls for compliance are growing amid an increase in COVID clusters. This week, members of Orthodox Jewish neighborhoods protested recent restrictions put in place to curb COVID-19 spread. Though a virus vaccine is still in the works, one CDC official says formal plans to distribute it once it's available are on target to meet an October 16th deadline in some states and in D.C.
Like so many, Estefania Hidalgo has quietly endured the challenge, the inconvenience of living through a pandemic. But she wanted to do more.
This was a way for me to take back control of the situation, to feel like I was in a less hopeless place, in a less hopeless world, and be like, okay, I can do this to make it better. I chose not to be in fear.
So she volunteered to be deliberately infected with the coronavirus.
I was shaking, but then without knowing, I just typed my name in and was like, let's go for it.
Shaking?
I want to be a part of it. Yeah, because it can be scary, right? Like, you're going to be potentially exposed to the virus.
Yes! Alistair Fraser-Urquhart is also very keen to be infected.
I've just got the email.
He helps with running the recruitment campaign Estefania signed up to. One day sooner finds volunteers, so far tens of thousands around the world, and has been lobbying the UK government to make use of them through potentially risky research.
I wake up thinking about challenge trials and I go back to bed thinking about challenge trials.
Challenge trials involve giving young, healthy people a potential vaccine, like this one developed by London's Imperial College, and then later testing it by deliberately dosing them with the virus. Proponents say it's faster than waiting for test subjects to be exposed to a specific virus in the real world. With numerous COVID-19 vaccines being developed, some scientists think challenge trials could help identify the best of them sooner.
By taking that small risk on myself, I can, potentially protect thousands of other people from, having to be infected without consenting to it.
Critics say challenge trials have limited use because the young, healthy people who take part don't represent the broader population. They have been used against other viruses.
Hi Tom, welcome to Flu Camp.
Thank you.
Through to quarantine then?
Yeah.
This is corporate video from a London facility that recruits, exposes and strictly quarantines people to test influenza vaccines.
We've got a wonderful safety record that we're all proud of.
But there are always risks, especially with a new virus that's already killed more than 1 million people. And epidemiologists say it's likely some volunteers would be needed for a control group to make sure the virus dose can cause disease. It means they'd be exposed to the coronavirus without receiving a vaccine. The real potential for doing harm to volunteers would be closely scrutinised by regulators.
A challenge trial would have to make the cogent argument that the benefits to society greatly outweighed the risk, and that evidence or those data could not be achieved in a simpler, safer way.
Built out both of them.
Test subjects in challenge trials are compensated financially, but Alistair's father knows that's not motivating his son.
It's at the forefront of science and technology. It's something to benefit others. It's something rather brave. It's something slightly different, and that's him in a nutshell.
To be totally honest, I really don't care what he says. I do what I like.
A crucial ingredient for any COVID-19 challenge trial will be the determined idealism of its young volunteers. Phil Black, CNN, London.